the record. Okay. It'll help if I share the screen.
I can't hear it.
Diana?
Yes.
Maybe I can share it from my screen.
Okay.
Let's see. No, it won't be able to work.
Loudest that we could get it. Can people hear it a little bit?
Yes, it's garbled, really garbled. I mean, I hear words, but they're kind of all mushing together.
Yeah, ditto.
I'll just continue playing a little bit, and then it's really short.
The monster feels bad when your monster wants to grow and your monster wants to shout. There's a way to calm your monster and show your monster out.
Oops, that's it.
That's it. So I'd like, at this point, to introduce our guest speaker for today, David Lunsford. You got his little bit of bio on him, but I'll read it again. He's a neuromuscular therapist in Minneapolis and a lifelong, ever-evolving learner. He holds a degree from the University of Minnesota and has done extensive training throughout the world focused on health and healing. He works with clients one-on-one basis and teaches a small group in small group settings. His clientele includes a wide variety of people interested in health and wellness, from Fortune 500 CEOs to entrepreneurs and teachers, and even an executive coach like Marianne. He will share some of the basic research on mindfulness and facilitate a chance for each of you to try it out for yourself. So there will be a little bit experimenting within our time together. Take it away, David.
All right, thank you very much, Diana. Hi, everybody. Today we're going to talk about a type of breathing that is based on meditation, but it is not meditation. I don't know, can you hear me now?
Good.
I don't know why, all right. I didn't touch anything, so.
I touched something.
Okay.
So I'm going to ask all of you to mute yourself because I could hear typing in the background.
Ah,
I wasn't, okay. Where shall I start?
You're fine. You can go.
Should I just start over?
Sure, please.
Okay. Well, we're talking about a 5,000-year-old practice, meditation, but from my experience, meditation has been, the word itself is abstruse, that people get kind of nervous with it or intimidated by it because it's a difficult practice to do for some people. So basically what we're going to be doing is learning how to breathe. And what I'd like everybody to do in this moment is take 3 big breaths. after you've taken those 3 breaths, whoa, Marianne, I think, did you turn off your microphone? Oh, thank you. So after you take your 3 breaths, I'd like you to answer these 3 questions, and you can either write them down or you can just keep them in your mind, but we're going to come back to this later. Number 1, in what part of my body did I feel or take my breath? Number 2, was there a physical sensation when I took the breath? Number 3, how do I feel after taking a breath? Now, I'd like everybody to take 3 more breaths, but I want you to take them as high into your chest as you can. So please take 3 breaths really high up into your chest. Now, I'd like you to make those observations on the same 3 questions. The first question was, you took the breath in the upper part of your chest. So that's the answer to the first. The second was, what was your physical sensation when you breathed high into your chest? And number 3, how did you feel after you took those 3 breaths high into your chest? So basically the answer to when you breathe higher into your chest, it activates your parasympathetic nervous system. And we all know this, that if you breathe too high up, your body tends to respond with a fight or flight syndrome. And this is a response to the enteric nervous system. The enteric nervous system is one of the main divisions of your autonomic nervous system. It consists of a mesh of neurons that governs the function of your gastrointestinal tract. This is what's primarily known as the gut brain. And so when they say trust your gut, your intrinsic nervous system, the enteric nervous system, is what controls your parasympathetic nervous system. So it's what controls your digestion, your rate of breathing. It'll impact your heart rate. It impacts your immune system. It can impact your saliva like it's doing for me right now. So in your gut, you actually have gray matter. You have over 1 billion cells, so it actually acts as a brain and responds with fear. And Diana, if you would you please put up the first slide? So this is an example of the amygdala. And the amygdala is what controls our parasympathetic nervous system. So when we go into fight or flight, if we're not breathing properly, immediately our eyes focus and try to find where the threat is, goes through the thalamus, visual cortex, and is processed through the amygdala. The amygdala then sends out whatever signals it needs to, whether it be hormone or control the parasympathetic to control the heart rate. It'll pull the blood from your gut and send it directly to your muscles. So you'll start cramping in your gut and be ready to act as you need to. What we're looking for is, would you please put up the next slide, Diana? There should be, oh, thank you. And the next slide is perfect. This is what we are looking for. You'll see that tiny little red dot is the amygdala that we prefer to have. What happens when you start to breathe in the proper way is that the amygdala will actually shrink in size, and the hippocampus, which lies underneath the amygdala, The hippocampus is directly below the amygdala. It's this elongated organ. If you can just follow, it'll trail off to the right. That's where you house your memories, emotion, it's long-term memory. And what has been discovered is that through meditation, the amygdala actually shrinks, the hippocampus actually grows in size, and so you no longer have a fight or flight response, or it is as an extreme. And you can, this way you can discern in the moment when you're working with other people or when you're working with yourself, what is fact, what is your truth, what is their truth, and then you can ascertain what truth is in that moment. Thank you. You can take that slide down, please. So in the late 90s to early 2000s, there was a Nobel Prize winner by the name of Elizabeth Blackburn. She did brain scans and tested for hormone levels and enzyme levels. And one of the things she discovered is when people meditate over a long period of time, that their chromosomes, which if you would put up the next slide, Diana, their chromosomes elongate after they did at approximately 3 months of meditation at an average of 20 minutes a day, 20 to 40 minutes. So how did their chromosomes elongate? And this is at any age. So these chromosomes elongated to the point where they would appear to be a 20-year-old's chromosome. When you meditate, your body produces a higher level of telomerase, and that telomerase actually repairs the chromosomes. And that is one of the reasons why they think people who meditate a lot look younger. Faces actually soften. But thank you very much, Diana. But and you can, this is a good explanation of what a telomere is. And she has gotten world-renowned attention for this, and got a Nobel Prize. And she continues her research. And if you want to see a video on her, she does a really good TED Talk on the topic as well. And it's in a bibliography. If you want the bibliography, Diana has it, or I can send it to you. But my favorite result of what we're working with and why I teach breathing in the work that I do are cytokines. And cytokines are proteins that are messengers sent by your immune system. Your immune system, once it gets a signal from an area that needs to be repaired, it can actually create the exact protein that goes in and repairs any given cell at any moment. The problem is, if you are in fight or flight the entire time, your brain becomes very disorganized, and you can't, the brain can't discern what cells need to be repaired. So it just starts frantically sending out these proteins. And a lot of autoimmune disorders happen because of these things. A lot of people who have inflammation throughout their body, so high levels of arthritis is what people undergo. However, if you learn how to breathe properly and you calm the parasympathetic, this miraculous thing happens where any protein that you need to repair any cell will be sent there immediately. And the best way to prove that, you may take that down, please. In my job, I work with people with chronic unexplained pain. So people who come in, I'm kind of the end of the road guy. They don't know the physicians they've worked with or any other therapist. No one can quite understand why they continue to have the pain they do. So if it's soft tissue related, or if it's arthritis or salivary glands, so if it's glandular, I can help them stimulate these areas or solve the issue for them by these cytokines. And then the miraculous thing is that when I go in and I apply pressure, they have either a rapid breath rate or rapid heart rate. And once we get that heart rate down, as I apply pressure and maintain constant pressure, and they breathe in this specific way that we're going to talk about today, they can actually feel the tissue soften and the pain completely dissipates. And then at that point, we retrain, because our brains are so dang smart, they create superhighways of networks for nerve impulses. And if you are working at your desk and you're all hunched over all day long with your shoulders up, and you have one of your feet tucked underneath your chair, your brain is going to have to communicate every single time you move, let's say your right foot, because you had that tucked under your chair. It has to communicate through your shoulders, down to your foot, back up to your brain. So every time you move that right foot, your shoulders are going to tense somewhat as well. So what I do is when I go in and I initiate the cytokine response, if I'm working on your shoulders, the inflammation is reduced by the cytokines because we're breathing properly, and then there's a disconnect at that moment from any other area in your body, and your brain no longer has that same neurological connection. Now, how did I know about cytokines? Well, there's a fantastic book called Trust Your Gut, written by Mark Weisberg and Greg Plotnikoff. And if you want to check that out, it'll be in the bibliography as well. But they talk about the enteric brain, how this gray matter that lines the cells under any given moment, depending on what your diet is, what levels of bacteria you have in your system. So if you have a battle going on in your gut, it's going to actually impact the rest of your body. And that's what they talk about neurologically, that you have to have a healthy gut in order to have a healthy neurological system. Oh, now, how do we breathe? This is the fun part. If you would, please, Diana, put up one of the slides that deals with the transversus abdominis. Thank you. So the transversus abdominis, it lies underneath the rectus abdominis. And there are a couple other layers of abdominal muscles above it. But you can see where there are openings at the bottom. The rectus abdominis sits on top of the transversus and slips down through that hole and connects to the pubis, the pubic bone down below. What we're concerned about is this rectus abdominis. Would you please put up the next slide? With the rectus abdominis, it has origin points that connect with 3 specific vertebrae. And those vertebrae are basically T7 through T10, I believe. And T7 is where your digestive tract comes out. So the main nerve that feeds the digestive tract comes out of the spinal cord at that upper level. And then as it wraps around, the other place that it attaches is the pubic bone in front. So if this transverse abdominis is not functioning properly, it actually constricts the nerves that tell the rest of your body how to respond in a stressful situation. So at this point, I would like all of us to start breathing again. And what we're going to try to do is learn how to isolate the transverse abdominis. And the way to do that, we could go to the next slide, please. So you have to learn how to isolate the area between our navel and the pubis bone, or the pubic bone. So it's the very top. So what I'd like everybody to do is please put your hand on your pubic bone, and it's below your bladder. So if you are a little high, you're gonna feel like you have to urinate if you push too hard. But try to find your pubic bone. And now what I'd like you to do is only take a breath between your navel and your pubic bone, and you should feel your lower hand raise and subside. And if you can't feel your fingertips at your pubic bone raise and subside, then try to pull even lower. These are called Kegel, the Kegel muscle, you know, the Kegel muscle. If you can try to get that low, that's what you're trying to integrate. Now, as you breathe, I only want you to focus to try to breathe between your belly button and the pubic bone. And I want you to inhale through your nose, exhale through your mouth. When you can make a noise, it's best to make a noise. Now, after you find that space between the pubic bone and your belly button, I want you to take a breath pulling into your low back. So you want to basically create a donut around your entire body. So please try to do that. Breathing into your sacrum, into the low back, feeling the back of your body expand and the front of your body at the same time. Good. How did it go? Everybody doing okay?
Roberta Wilmot to the front counter for a lost article, please.
Oh, I thought someone was saying something. I guess not. Diana, what I'd like to do now, if we could please, is break up into small groups. And what I'd appreciate everybody doing is once you're in your small group, take 5 of these breaths, and we're going to answer those 3 same questions. You already know from where you're supposed to be breathing, but the other 2 questions are, what is the physical sensation that you felt when you took the breath? And how do you feel after taking the breath? And then I'd like to talk about it in our groups and see what our observations are.
And how long do they have, David?
5 minutes.
Okay, sounds good.
Thank you.
Hi, Richard. Hi, Richard. Hi, much better. How are you? It's nice to see you.
Lauren?
Were we supposed to be in groups of 2, Diana?
We were.
Okay, we didn't know if we were waiting for more people at that point.
Oh, I'm sorry.
No, that's okay. But
Yeah, that's something for me to remember to be clear about.
we just started talking, so.
Good. This is the first time I've ever managed doing the breakouts. I've been in them, but it was like, ooh.
Yeah, that's
And I couldn't tell.
pretty cool. You did. It was great. You're doing a great job.
That was actually a pretty cool technique.
Look forward to seeing you. Thing goes on.
The people have returned.
Hello, hello.
Hi, everybody. I had a great talk with Sonia.
Had a great talk with you.
Thank you. And should we go over, does anyone have any major observation, or do they have something they want to say at this moment? Is there something pressing?
I have a question. So this feels very similar to, the breathing techniques, we learned in singing, breathing from the diaphragm. But are we supposed to be breathing even lower than the diaphragm?
You're much lower than the diaphragm. I do not.
I had a hard time with that.
Yeah, it is. It's difficult. Is there, so you basically, when you did the breathing technique, you were breathing from the diaphragm today?
Well, I was trying to breathe lower, but I don't know that I accomplished it.
And that's what the practice is. I encourage you as much as possible to continue to try it. And the sole reason why is if you are in your diaphragm, you continue to activate the parasympathetic somewhat, which singers need, which all performers need, because you need some level of adrenaline. If you do that basic, really low belly breath, you're going to lower your heart rate very quickly.
David, I had a question. I try daily to do still some of the Lamaze breathing techniques that my wife and I went through when we were going through that. And it's really helped, and there's some similarities here. But with regards to what we're trying here, and next week or when we kind of forget what you have talked about, is there like YouTube videos we can look up, or is there any kind of video that we can go through and use as a training part?
Is for this specific breath, there is not. There is if there are belly breathing videos, and they are good. The reason why I focus on the pubic symphysis, that pubic bone and in between the navel, is because I found that's the easiest way to raise the cytokine levels. So I primarily work with people if you want to calm your pain or your anxiety. Go ahead, Diana.
I'd like to add something because I did biofeedback and taught this technique for years to people with anxiety. And one of the ways in which we were teaching it was to put one hand on your upper chest and to put your thumb in your belly button and spread your hand out. And the challenge is to keep your chest from moving and have your other hand moving in and out, because it gives you a central feeling of breathing appropriately. But it lowers anxiety just in a snap. But it's hard to practice that way because none of us tend to do it naturally.
That's perfect. Thank you. So, Merritt, if you can find, Diana, do you have a video of that?
No, we just used to demonstrate it.
That's perfect. Yeah, I really haven't seen many videos on it recently.
David, a question for you.
Yes, sir.
I felt like when I was doing this breathing that something had to be moved out of the way for me to get air down there. Is that just because this is new and uncomfortable, or is there something physiologically going on other than perhaps I'm old and overweight?
It is there's nothing that needs to be moved. It's just you're training, you're actually training yourself to pull the lower lobe of your lung down.
Maybe try to go to the bathroom first, Paul.
No, I don't think that was it. Sorry.
Well, I mean, okay, so, but this takes me to a very good story. I had a client recently who had a lung infection. And when this person went to see her physician, the physician asked how she could possibly breathe because she bypassed the infection in her lungs and went to the lower lobes of her lungs. And it was because she knew how to take this belly breath. And so that's Hilmer, that's the name I see. That's kind of the issue that I think you're dealing with.
Okay.
Is that you're learning how to pull as deeply as you can into the transverse abdominis, into the Kegel muscles. Do you ever do Kegels? Is that?
No, but it sounds like I'm going to start.
Yes, that's one of the best ways to activate it.
Okay, thank you.
You're welcome.
So I have an application question, and I'm not sure if it's appropriate to ask now.
Okay.
If you're going to answer it later, you could just say you're going to answer it later. So I'm a swim coach, and we focus a lot on breathing, and in particular breathing before races, because a lot of times, you know, they tense up and they get anxious and they actually forget to breathe when they're preparing for the races. But it occurs to me that this technique would be very useful, like post-exercise, to help the recovery process. That's just a thought I have. Would you agree with that, or would this be better to do prior to exercise? Just try, in terms of an application to my athletes, this is very useful for me.
While it would be beneficial prior exercise, I especially use this while I'm running once my heart rate is up, because I used to have abdominal cramping on one side of my body because I would work my right more than my left. So it's best to do this breathing when you're in pain or when you start to go into distress.
Okay.
It's most effective in that way. So post-exercise, it's also great. It's good. It's just a good tool to have if you're in an argument or in a stressful meeting, all those types of things. So it's mainly to activate, you're basically hacking your own immune system at this point and your own nervous system. Go ahead.
May I add something?
Sure.
One of the pieces Jerry, when I was doing biofeedback, is our Olympic athletes, for the first time at the time when I was doing my training, were using this technique actually prior to the performance. So it's been used with athletic teams.
Wow, that's great.
So there actually is quite a bit out there in research on the biofeedback aspect of it, but the key to it is the breathing. Jerry?
Absolutely. You know, there is tons of information on breathing. I am by far not the first person to ever talk about this, and there are lots of different ways to access any sort of breathing technique that's really effective. And as I said at the beginning, I mean, this is 5,000 years compared to any other way to reach a higher self, if you will. And all we're doing is basically saying that we're just trying to make ourselves feel better. And I think that's the highest self. You know, we've got a bag of flesh and we have to be able to navigate it as much as possible. And all of you are going to be in high-powered positions. You're already in very big or very highly responsible positions. And I was hoping to be able to inspire you today to do something for yourself so you know that you're making the best decision at any given time. I have one more story, and then if we can go to questions, and we can wrap things up. One of the great honors that I've had was to meet a visionary, Penny George, and she started the Penny George Institute, which is the second alternative health hospital in the nation. And she realized when she got cancer that that physician's bedside manner and support for patients was basically at zero. So she made it her mission. She basically said if she survived that, she was going to make it her mission so that everybody would have proper health care and feel safe, secure, and understand that they didn't have to suffer emotionally and physically while they were getting care. So she, after creating the Penny George Institute, one of the main components of that was meditation. You know, along with all these alternative practices, acupuncture, still meditation, massage, still meditation, reflexology, still meditation. It all comes down to focusing on your breath and not focusing on what problem is at hand or what stress is at hand. And the Georges have even taken that even further with their foundation. And I've just, the reason why I bring that up is there's a tremendous social discourse that takes place. I mean, God bless sociology, because it takes science the direction it needs to go, and that's a lot of what all this research is today. Is society driven. So I only bring that up because the medical field is changing rapidly to accommodate this type of work, and I'm really happy about that. So, in closing today, and then we can do question and answers, I'd like to read a quote from Brene Brown that when we're looking for compassion, we need someone who is deeply rooted, is able to bend, and most of all, embraces us for our own strengths and struggles. And that's what I hope this breathing does for you, because that's what we need to do for one another. So thanks for listening.
Thank you. Well, I'm curious, a couple different things, questions, but I'm wondering if anyone here has any type of a meditative practice.
Yes.
Do you want to share any?
Let me unmute myself here. So I do. It's a little bit inconsistent. I would like to get to more of a consistent one, but this goes along with a question that I was going to ask. Is sometimes I actually, if I shut my lights off and shut my door, and I actually get into it and am dialed in such a state that that the meditation practices and the breathing practices are most effective. The problem that I have is I get to such a relaxed state that I'm not super effective for the time after that. In fact, one time I fell asleep. So any suggestions about coming out of that type of technique?
That's a good question. Anybody have any suggestions on coming out of that?
You obviously are very good at it, Merrick.
Yeah.
Well, sometimes.
That's impressive. Good for you. I guess what is the negative of having yourself at such a calm state? What's the negative for you?
Yeah, I think as we all deal with things on our campus, there's a need to be alert and intense and ready to act on instincts instantaneously. And I think just the relaxation and maybe that's a good thing where we can pause between before we have to make a decision, just to process and to think through. So I don't know.
That's it. You've got it. That's exactly what I'm talking about. I think that that was really wise what you just said. That's your answer.
Okay. Good.
Please don't live your life always on the ready to react. You are learning how to, you got yourself in a position where you get to respond. So I think you're right on. Yeah.
Thank you.
You're welcome.
So truth in advertising, David is a great mentor of mine, but one of the things that I've found working with this breathing that he's laid out today is that often when I come out of that, I'm in a kind of grounded, centered state rather than really relaxed. And that maybe that is a little bit of a nuanced difference. I don't know, maybe David, you could talk more about that. Other meditative practices I've had have been oftentimes really relaxed to the point of falling asleep. This has just been a really different, these really deep breaths from that grounded place has been a different kind of meditative experience for me.
I appreciate you saying that, Marianne. And part of, I agree with you. I would sometimes fall asleep during meditation as well. The point of doing these breaths is that you're not doing them for long periods of time. You are taking anywhere from 3 to 5 breaths, and then you go about to whatever you're going to do, and then you come back. If you need to take 5 more breaths, take 5 more breaths. But I'm not asking you to do this for 20 to 40 minutes a day. I have found by breathing this way for a short period of time, I change my metabolic state, and I actually can get rid of a headache, neck pain, all of that, because I no longer focus on what I shouldn't be focusing on. I take my mind off of it so that my body can heal it immediately. And that's also heart rate, all that.
So I have a very simple technical question. Is there a better physical position to be in as one is learning this? I mean, should you be laying down, standing up? I'm sitting at my chair with my warm tights on, and, so maybe just as we're trying to get in it, what is the optimal way to learn how to do this?
Well, and I hope I have her name right. Sonia, is that correct?
I'm Bobby.
Bobby.
No, the person who I broke off with in my group, she and I had this conversation. But you can be lying down, which is ideal to do this. But I have been throughout this entire conversation breathing in a seated position. The whole point is to be able to learn how to do this at any single moment. So there's no ideal place. It's to master the breath itself. Does that answer your question? But yes, lying down is great, but I want you to be able to, I don't know, be standing in front of a lion and take a belly breath and be able to grab the biggest stick, you know, figure out how to get out of the situation.
I was saying,
Go ahead.
I was sharing with David that we practice this 1 day a week during chapel time. This is our second year, and we invite 2 different practitioners to lead us into this. And I got to tell you, it's the best way to wake up on a Monday morning to know we're going into this. And then just personally looking back, I realized my dad died when he was 94, 5 years ago. And I didn't realize until recently that he actually practiced mindfulness on a really daily basis and breathing exercises just really anywhere he was. And I wish he were still alive today so I could talk to him about it. Where did he gain these? You know, because he was dyed-in-the-wool Lutheran, but open out of that to a lot of different wonderful ideas. And we're at Augsburg kind of exploring, and I would ask you the question, how can you help us explore how this practice is tied to anti-racism work and intentional diversity? We're really intrigued with that.
That's a big question. Will somebody else chime in on that? I'd have to think about that.
Seems to me a good place to start is to say, before you have any kind of dialogue, this kind of exercise can get people in a calm place where they're willing to have an open discussion and maybe be less inclined to get overexcited or defensive.
Well, adding on to what you just said, Paul, going back to what you said, David, it shifts you from a place of being reactive to responding. And I have worked with people, and many of the fellows that I've worked with over time, they do it in between appointments so they can let go of whatever this last appointment was and bring themselves back into a centered position to be fully present for the next meeting or next person, because many of you have schedules that is just back to back to back, and sometimes you don't have time to shift. And doing 3 to 5 breaths, I contend that anyone can do.
Absolutely. Diana, that's such a great point. I do that in between my clients. When I am back to back with clients, the one leaves, another's waiting. I come back into the room first, take my 5 breaths, walk back out, and I'm set. Thank you.
Can I offer one more thing to my peers? We have a faculty member, for those of you that are faculty and wondering about connecting this to curriculum, we have a faculty member who piloted a course last year on spirituality, mindful practice, and recovery, because we have a large recovery community on our campus. And I know he'd be willing to be in conversation as we all learn more about this.
So, Sonia, could you give us his email address?
Yeah, I'll post it.
Great.
Definitely.
I'll share one short story about another fellow that I had, a gentleman who kind of joked around and scoffed a little bit at this idea of meditating or breathing because he had not ever done that and didn't see the purpose of it until he became a dean. And, you know, had his breath taken away a little bit about the scope of the relational things that he needed to do. But sitting in his office wasn't something that worked for him. And so he started scheduling walking meditation every day at noon for himself. And he did the deep breathing, but he needed movement, that the way he's wired. And so he just did a half-hour walk and did the breathing and emptied his mind in the middle of the day.
Wow.
So going back to what you said, Bobby, there isn't a way that it has to be done.
Absolutely.
But finding maybe a couple different ways that are effective for you can ground you from one thing to another that you are called to do.
Yes.
One last question. Well, thank you, David. Very grateful for you joining our group and sharing your expertise. And I wish you well. I wish everyone well in terms of practicing this breathing. It can cause great changes in your body, I've seen over time when I was doing biofeedback. So please consider making it part of your little circle of taking care of your core, at least over the next couple months. Just playing with it and seeing how it works.
Thank you.
Thank you.
Thank you,
Thank
David.
you.
Bye.
Bye-bye.
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 Safe travels. See ya.